Carolina congressman, Republican. He's also a physician, so he knows of what he speaks. I believe the only practicing physician in Congress. Congressman, very good to have you.
Good to see you.
How do you feel about Robert F. Kennedy Jr. coming to head HHS?
Well, I think what the president has done with all his appointments, they have been disruptors in one form or the other. I'm not for disruption for the sake of disruption, but we've had too many things go on for decades upon decades upon decades that need to be reformed, that need to be rechecked. The FDA, pharmaceutical industries, so many other things, SNAP benefits, that I think it's a healthy bit of disruption to say, hey, let's rethink some things rather than just continue the status quo. Do I agree with RFK on all of his statements? Probably not. I've been a physician for 35 years, but I do think he has a lot to offer to helping us reform an industry and rather a section of our society that desperately needs reform.
Well, I don't like to belabor what the market is doing on this appointment, or right now, or at least this consideration on the part of Donald Trump to put RFK Jr. in charge of Health and Human Services. All the Medicare, healthcare, pharmaceutical stocks, almost every single one is down. And I'm wondering if that is telegraphing an environment that will be very inhospitable for them if he takes over.
I don't think so. I think this is short term. I think, when you get in and you learn the nuts and bolts and you see what's going on in the industry, things will stabilize. I will tell you, I've been a physician for over 30 years, and the pharmaceutical industry has brought cures and treatments that 30 years ago we would not even imagine. So to totally throw it out is absolutely wrong. Does it need reform? Absolutely. And there's so many different things. We agree on direct-to-consumer advertising with JFK. There's only one other country it has in the world, and in my opinion, as a physician, it adds nothing to the care of patients. So I do think there are, target-rich areas that we can work on to make America a healthier nation.
You're a physician, so I'm probably speaking to the choir here, but one nice thing that I would like to see, and looking at the medical community, is approval of drugs in desperate cases for those who have nothing to lose getting access to a new drug or one that's going through trials. For that subset of the population, that would be welcome news. I just wonder, will we ever see that?
Yeah, there is this, this is this rule of the right to try. And I've seen many cancer patients who fail so many other therapies, and sadly enough, they're kind of at the end of their rope. And there is a right to try in some of these instances. But guys, if you look at even the last decade, the number of advancements that have been made in cancer care, it's unbelievable. It's astronomical. Can we afford these things? Can we afford all the new novel treatments that do wondrous things? That's a real question. And what are they doing as far as the health of the nation? I think there's a lot of things that we need to disrupt and rethink. But I think RFK can do a great job at that.
All right. It's refreshing to someone of your stature and knowledge, saying you're open to a Robert F. Kennedy. You want to hear what it's about, maybe hear what he has to say. And there's a concept, just waiting and being fair about that. So, Dr. Congressman, thank you so much.